How does the sickness role impact health care? Imagine feeling unwell and suddenly being granted special rights and responsibilities just because you're sick. That's what the sickness role is all about. It's a concept from sociology that explains how society views and treats people who are ill. When someone is recognized as sick, they get certain privileges, like being excused from work or school, and they are not blamed for their illness. At the same time, they have to want to get better and cooperate with medical advice. This setup helps society accept illness as a temporary state and makes it easier for patients to seek help without feeling guilty or judged. From an anthropological point of view, the sickness role shows us that illness isn't just about biology. It's also about culture and social expectations. Different cultures see sickness differently, which influences how people respond to being sick. For example, some cultures might encourage people to hide their symptoms, while others promote open discussion and seeking help early. These cultural beliefs shape how quickly people go to the doctor, follow treatments, or even talk about their health issues. The way the sickness role works also affects how doctors and patients interact. Doctors act as gatekeepers who confirm if someone is truly sick by making a diagnosis. Once they do, patients gain access to social support and healthcare resources. But sometimes, patients resist the role if they don't see their illness as temporary or if they have a chronic condition that doesn't fit the usual model of getting better and returning to normal. This can cause tension because the healthcare system expects patients to follow certain behaviors. Understanding the sickness role helps healthcare providers see that illness isn't just physical. It's also social and cultural. For example, patients might feel pressure to recover quickly or to continue fulfilling some social roles despite being sick. Recognizing these social expectations can help doctors and nurses provide care that respects each patient's unique situation. It encourages them to listen more closely to what patients need beyond just the medical treatment. In healthcare, knowing about the sickness role helps improve communication and treatment plans. It reminds providers that illness involves social rules and expectations that influence how patients behave and respond to care. Anthropology shows us that these roles change across cultures and situations, which can impact health outcomes. By understanding this, healthcare systems can better support patients, especially those with long-term or chronic illnesses, by respecting their social realities and cultural backgrounds.